Welcome. Today we're diving into a complex eye condition, uveitic cataract. Cataracts, generally, are the clouding of the eye's natural lens. When this clouding occurs as a result of uveitis, an inflammation of the middle layer of the eye, it's specifically known as a uveitic cataract. This can significantly impair vision and impact quality of life, so understanding it is crucial. So, what causes uveitic cataracts? The root cause is the inflammation of the uvea, the middle layer of the eye. This inflammation, known as uveitis, can stem from a variety of sources. These can include autoimmune diseases like rheumatoid arthritis, lupus, or ankylosing spondylitis, infections such as herpes toxoplasmosis or tuberculosis, injury to the eye, or in some cases, the cause remains unknown, termed idiopathic uveitis. The chronic inflammation directly damages the lens fibers, leading to cataract formation. Let's delve into the pathophysiology. Chronic uveitis disrupts the normal environment within the eye. Inflammatory mediators, like cytokines and growth factors, are released during the inflammatory process. These substances damage the lens epithelial cells and alter the lens protein structure. This damage leads to opacification or clouding of the lens. Moreover, the inflammation can disrupt the lens's metabolic processes, further contributing to cataract development. In addition, long-term use of corticosteroids as part of uveitis treatment can itself contribute to cataract formation. Understanding the prevalence of uveitic cataracts is important. Uveitis itself is relatively rare, affecting around 50 to 100 people per 100,000. However, a significant portion of individuals with chronic uveitis will develop cataracts. The exact percentage varies depending on the type and severity of the uveitis, but studies suggest it can be as high as 40–60% in patients with long-standing or poorly controlled uveitis. This emphasizes the need for early and effective uveitis management to minimize the risk of cataract formation. What are the signs and symptoms to watch out for? The symptoms of uveitic cataracts are similar to those of other types of cataracts, but may be complicated by the underlying uveitis. These include blurred or cloudy vision, glare, halos around lights, difficulty seeing at night, and changes in color perception. Individuals with uveitis may also experience pain, redness, light sensitivity of photophobia, and floaters. It's important to note that the presence and severity of symptoms can vary widely depending on the extent of both the uveitis and the cataract. How is a uveitic cataract diagnosed? A comprehensive eye examination is crucial. This includes a visual acuity test to assess sharpness of vision, a slit lamp examination to evaluate the lens and other eye structures, tonometry to measure intraocular pressure, and a dilated eye exam to visualize the retina and optic nerve. In cases of suspected uveitis, further investigations like blood tests and imaging studies may be performed to identify the underlying cause of the inflammation. An important differential diagnosis is differentiating a cataract that is truly from uveitis versus just an age-related cataract. In these cases, your ophthalmologist will consider the pattern of cataract and history of uveitis. While uveitic cataracts aren't typically classified into distinct types like other cataracts, their presentation can vary depending on the location and severity of the uveitis. They can be described based on their density: a mild, moderate, severe, location within the lens, anti-anterior, posterior, or nuclear, and the presence of other complications like posterior synecdoche, adhesions between the iris and the lens. Understanding these characteristics helps guide treatment decisions. The treatment of uveitic cataracts is multifaceted. The primary goal is to control the underlying uveitis with medications like corticosteroids, immunosuppressants, or biologics. Once the inflammation is well controlled, cataract surgery can be considered. However, surgery in these cases is more complex than in standard age-related cataracts. There's a higher risk of post-operative inflammation, glaucoma, and other complications. Therefore, meticulous surgical planning and post-operative management are essential. This may include anti-inflammatory eye drops, careful monitoring of intraocular pressure, and in some cases, additional procedures to manage inflammation or other complications. Is prevention possible? While it may not always be possible to prevent uveitic cataracts entirely, early and effective management of uveitis is key. This includes adhering to prescribed medications, attending regular eye exams, and promptly reporting any changes in vision or eye symptoms. Managing underlying systemic diseases, such as autoimmune disorders or infections, can also help reduce the risk of uveitis and subsequent cataract development. Healthy lifestyle choices, such as avoiding smoking and protecting your eyes from injury, also play a role in overall eye health. What's the outlook for individuals with uveitic cataracts? With appropriate management, the prognosis can be good. While cataract surgery can effectively restore vision, long-term success depends on controlling the underlying uveitis and managing any post-operative complications. Recent advances in surgical techniques and intraocular lens technology have improved outcomes. Furthermore, ongoing research is focused on developing new therapies for uveitis, including targeted biologics and gene therapies, which may help prevent cataract formation and improve the overall visual prognosis for individuals with this challenging condition.